In this section, we'll explore the pain pathway and how opioid receptors interact with this system. Pain begins when an injury or inflammation occurs somewhere in the body. At the injury site, specialized nerve endings called nociceptors detect harmful stimuli like tissue damage or inflammation. These nociceptors convert the harmful stimulus into electrical signals that travel through nerve fibers. The pain signals then travel through peripheral nerves to the spinal cord and up to the brain. In the brain, these signals are processed and interpreted as the sensation of pain. Opioid receptors are specialized protein structures found throughout this pain pathway. These receptors are found in three key locations: the brain, the spinal cord, and in peripheral nerves near the site of injury. Opioid receptors are complex protein structures embedded in cell membranes. They have a specific binding site where opioid molecules can attach. These receptors naturally respond to endorphins, which are our body's natural painkillers. They can also be activated by opioid medications, which have a similar structure to endorphins. When activated, these receptors initiate a cascade of cellular events. This includes blocking calcium channels, reducing the release of pain neurotransmitters, and ultimately blocking pain signal transmission. Now let's examine how opioids actually work in the body. When opioid medications enter the body, they bind to specific opioid receptors on nerve cells. These opioid molecules act like keys that fit perfectly into the receptor locks. When an opioid binds to its receptor, it triggers a series of important changes in the nerve cell. One key effect is hyperpolarization of the neuron. This happens when opioids cause potassium channels to open and calcium channels to close. When potassium channels open, potassium ions flow out of the cell, making the inside of the cell more negative. At the same time, calcium channels close, preventing calcium ions from entering the cell. Opioids also inhibit the release of pain-transmitting neurotransmitters from nerve terminals. Normally, when a pain signal arrives, these vesicles would release neurotransmitters into the synaptic cleft to transmit the pain signal. But when opioids are present, they prevent this release, blocking the transmission of pain signals between neurons. At the spinal cord level, opioids reduce the transmission of pain signals to the brain. Opioids block pain signals at multiple points along the pain pathway in the spinal cord. In the brain itself, opioids activate descending pathways that further inhibit incoming pain signals and alter emotional responses to pain. To summarize, opioids work through multiple mechanisms to reduce pain: binding to receptors, inhibiting neurotransmitter release, hyperpolarizing neurons, reducing spinal signal transmission, and activating descending inhibitory pathways. In this section, we'll explore the different types of opioids and their side effects. Opioids are classified into three main categories based on their source and chemical structure. Natural opioids like morphine and codeine are derived directly from the opium poppy plant. Semi-synthetic opioids, including hydrocodone and oxycodone, are created by modifying natural opioids. Synthetic opioids, such as fentanyl and methadone, are completely manufactured in laboratories. Opioids vary significantly in their potency, which affects their dosing and risk profile. Using morphine as our reference point with a potency of 1, we can compare other opioids. Semi-synthetic opioids like hydrocodone and oxycodone are approximately 1.5 times more potent than morphine. Synthetic opioids vary greatly, with methadone being about 3 times more potent than morphine. Fentanyl is exceptionally potent, approximately 100 times stronger than morphine, which contributes to its high risk of overdose. Opioids affect multiple body systems beyond pain pathways, leading to various side effects. In the brain, opioids can cause sedation, euphoria, dizziness, and nausea or vomiting. In the respiratory system, they can dangerously slow breathing, a condition called respiratory depression, which is the main cause of overdose deaths. In the digestive system, opioids slow gut motility, causing severe constipation and abdominal discomfort that often persists with continued use. Beyond their side effects, opioids can lead to dependence and addiction, which operates in a cycle. The cycle typically begins with initial use for legitimate pain relief. Over time, tolerance develops, requiring higher doses for the same effect. This can lead to physical dependence, where the body adapts to the presence of the drug. Addiction may follow, characterized by compulsive drug seeking despite negative consequences. Attempts to stop can trigger withdrawal symptoms, which are extremely uncomfortable. These withdrawal symptoms often drive relapse, continuing the cycle. Due to this high potential for dependence and addiction, medical supervision is essential when using opioid medications. In conclusion, while opioids remain valuable tools for pain management when used appropriately, their wide-ranging side effects and addiction potential require careful consideration and medical supervision.